Good afternoon, thanks for joining us today. I'm going to start with the usual run-through of COVID statistics. However, there is some important context to today's figures that I'm going to have to immediately attach to them. An additional 70 positive cases were confirmed yesterday. That represents 2.7% of people newly tested and reported yesterday, and takes the total number of cases to 22,749. Let me give the context, though, immediately. Today's numbers, both the overall results reported through the UK-wide system and the number of positive cases, are lower than they have been in recent days, and we believe that they are not yet complete. We understand other parts of the UK are experiencing similar issues this morning, and we are seeking to resolve these urgently. However, it's important that I am frank that we now have a very serious concern that the backlog of test results being faced by the UK lab network, which the Glasgow Lighthouse Lab is part of, is starting to impact on the Timaeus reporting of Scottish results. We've been raising these concerns with the UK Government in recent days. Indeed, over the weekend, the Health Secretary managed to resist a move to limit access to testing slots, mobile testing units and regional testing centres. However, this apparent delay in turnaround is causing us concern, and therefore we'll be seeking to escalate these discussions with the UK Government over the course of today. Let me stress that we are very keen to play our full part in addressing these issues and finding solutions to them urgently, but we need the UK Government to share the full scale and nature of the issues they're facing and the impact that they are having on Scotland, in order that we can collectively and very quickly find solutions. We will give an update, including any changes to today's figures, as soon as possible. I can also confirm that 264 patients are currently in hospital with confirmed COVID. That is 5 more than yesterday, and 7 people are in intensive care, which is the same number as yesterday. I can also confirm that in the past 24 hours, no deaths were registered of patients who first tested positive over the previous 28 days, and the total number of deaths under this measurement is still 2,499. I think it's worth reflecting on the sad fact that it was exactly 6 months ago yesterday that the first death from COVID was confirmed in Scotland. That death, and each and every one we've seen since then, has been a source of grief and heartbreak to families across the country, and therefore I want again today to pass on my condolences to everyone who has lost someone. Now, I'm joined today by the Health Secretary and the Chief Medical Officer, and we will all take questions shortly. But first of all, I want to focus on the continuing high numbers of cases we've seen over the weekend, and therefore the vital importance of the new rules that are coming into force in Scotland today. However, let me start with a thank you. More than 900,000 people have now downloaded the new Protect Scotland contact tracing app. As you will recall, we launched that last week, and that allows people to receive an automatic notification if someone they've been in close contact with gets COVID. You're not told the name of the close contact, but you do get a notification together with information and links to advice on self-isolation. 900,000 downloads is a really important milestone. It's already enough for the app, we think, to really make a difference. But it stands to reason that the app will make more of a difference the more people who use it. So I would encourage everybody across Scotland who hasn't yet done so to download the app, and also to encourage friends and family to do so. We're especially keen to encourage uptake among students who are starting at university or college this week, and who are perhaps especially likely to be coming into contact with new people whose names and contact details they might not yet have. So if you work in the further and higher education sector, or if you have children or relatives starting the new term, please encourage them to download the app. Fundamentally, we want as many people across the country as possible to download and use it. Downloading it is very straightforward. It takes less than 2 minutes to do. You can find the app by visiting the protect.scot website, which you'll see in front of us just now, or by searching on the Apple Store or Google Play. The app doesn't require you to give any confidential information. It's completely anonymous in how it works, and it helps to keep you and your family and community safe. So again, if you haven't done so, please download it now. The app is particularly important because the figures for new cases we saw over the weekend reinforce again that Scotland, like the UK and like many countries across Europe, is currently in a precarious situation. On Saturday, we had 221 new cases reported. Yesterday, we had 244. The percentage of people testing positive has also been increasing. Yesterday, it was above 3%. Just 3 weeks ago, it was consistently around or below 1%. We know that we've seen a significant rise in cases in recent days in Lanarkshire, which emphasises again the importance of the decision announced on Friday to restrict private indoor gatherings across North and South Lanarkshire. So if you live in either of these council areas, you should not at this stage be visiting any other households at all. The restrictions for North and South Lanarkshire are, of course, the same as the ones that were already in place in Greater Glasgow, in Glasgow City, Renfrewshire, East Renfrewshire, Eastern Bartonshire and Western Bartonshire. We hope these restrictions will help reduce transmission in these areas and will play a part, given how populous these areas are, in lowering our overall national figures. There will be a meeting later today to discuss the up-to-date position in Greater Glasgow and Clyde. However, although numbers in Lanarkshire and Greater Glasgow and Clyde have been of particular concern, most parts of Scotland have seen a rise in cases in recent weeks. And as I indicated earlier on, Scotland is not unique in this regard. Many countries across Europe are seeing similar. Transmission is higher than we can be comfortable with right now, and that is the case across the country. And the wider international picture is also a concern. Many countries in Europe are seeing an increase, and globally, the World Health Organization reported that yesterday saw a record number of new COVID cases around the world. So all of that helps to explain why we took the decision to change the nationwide rules on meeting up with other households. We believe that we need to act now, to act quickly to reduce the chances of an even greater increase in cases later in the autumn and as we go into winter. So from today onwards, a maximum of 6 people from a maximum of 2 households are now permitted to meet together. That rule applies outdoors, including in private gardens, as well as indoors. And by indoors, of course, we mean people's own homes, but also pubs and restaurants as well. Children under the age of 12 don't count towards the limit of 6, but they do count towards the limit of 2 households. I indicated on Friday that we were seeking some further advice on whether it was possible in some limited circumstances to exclude children from the household limit as well, and we'll report back on that as soon as possible. It's also worth stressing that the 2 household limit means that a meeting of just 3 people wouldn't be allowed under these rules if those 3 people all come from different households. And I'm aware that this restriction is a really tough one, but restricting the number of households who can meet is important in reducing transmission rates. The virus wants to find new households to infect, so we have to do what we can to limit the opportunities it has to do that. Now, 2 additional measures also take effect from today. They take effect in hospitality settings such as pubs, cafes and restaurants. Firstly, it is now mandatory for customers in those settings to wear face coverings when they're not eating or drinking. For example, when you go into the premises and go to your table, or when you stand up to move around to go to the bathroom, for example. And from today, staff who work in hospitality premises, with some limited exceptions, must wear face coverings as well. That's been in guidance so far. It is now, as of today, mandatory. These changes, as I said before, are not welcome for any of us. But the numbers of new cases we saw over the weekend and the numbers of new cases we've seen in the past couple of weeks emphasise again why we need to act firmly now. New cases in Scotland have been more than trebling every 3 weeks in the last few weeks. That pattern is not sustainable as we move further into autumn and then into winter. So if we all act collectively now, our hope is that we can stem that increase. So please, I'm asking everybody to stick to these new rules of 6 people in 2 households as a necessary way of trying to stem the spread of the virus. I'm asking also everybody to please download the Protect Scotland app if you haven't done so already. This is a simple, but it is a very powerful way of all of us helping keep the country safe. And as always, I'm asking people to remember the other measures that can reduce the risk of passing the infection from one person to another or from one household to another. And that advice is, of course, encapsulated in the FACTS rules. These are the 5 rules that can help all of us keep the virus under better control. So please remember F, to wear face coverings in enclosed spaces. Remember A, avoid crowded places, whether they're indoors or outdoors. Remember C, clean your hands regularly and clean any hard surfaces that you're touching. T is to remember to keep a 2-metre distance from people in other households. And S is self-isolate and book a test if you have symptoms. If all of us stick to this these tough restrictions and to remember that important advice, then working together we can help to get the virus under control again. It is worth remembering at this 6-month point into this pandemic, as the Deputy Chief Medical Officer said on Friday, it won't last forever. But while we're in this, we must all act collectively to keep ourselves, each other, the health service safe and ultimately to save lives. We are still in this together, and it is only by working together that we will get through it. So my thanks to all of you for joining us today, and we'll now, as usual, take questions from the journalists. I'll go firstly to Lisa Summers from BBC Scotland.
First Minister, are we already seeing an impact on the NHS of this new rise in cases? For example, in Glasgow, we know that some patients have had letters saying that their appointments for routine outpatient appointments, for example, have been cancelled because of an expected rise in demand over the coming weeks. And I guess, as you were saying about the percentages today, it's quite difficult to get an accurate picture, but how worried are you that we're getting close to that 5% figure of the population testing positive that the WHO says is an indication that the virus is once again out of control and there's widespread community transmission ongoing?
I'll hand over to the Health Secretary in a moment on health service preparedness. What I would say on that is that we continue, as we have been doing for some time, to take steps to remobilise the health service while also making sure that we are ready for whatever eventuality we face over the winter months. We don't yet see, we have seen in the last couple of weeks a small increase in hospital admissions. We're not yet seeing a substantial increase in hospital admissions, but we can't be complacent about that. Some other countries that are perhaps a bit ahead of us in this more recent increase in cases are now seeing a more substantial increase in hospital admissions and sadly in deaths. So we must be very, very cautious about that and not become complacent because we're not yet seeing those other indicators go in the wrong direction. If we act now to keep the rise in cases under control, we hope that we can then that way keep these other indicators under control as well. Finally, from me on the percentage positive, I've given a very strong caveat to today's numbers, and obviously we'll update that later on. But if I can perhaps refer more firmly to yesterday's numbers, which we saw 244 cases reported yesterday, and that was 3.7% positivity rate of 3.7 of those people who had been newly tested. Clearly, that is a big increase on the percentage positive that we've been seeing recently, and therefore we will be monitoring that as we're monitoring everything closely in the days to come. We want to keep it below 5%, but again, you know, if we look at France in the last few days, France's positivity rate has gone over 5%. Now, you know, we have to look at everything in the round, but it's another reminder that we are in a more precarious position as we go into winter than we've been over the latter part of the summer. And it just underlines the need for us all to pay attention to the rules and abide by all of these rules so that we keep this under control and continue to bear down on it rather than allow it to grow even further. Jeane, do you want to add on the health service preparedness?
Yes, thanks very much. We all want our health services to start as they were before the pandemic hit us. But there's some really important areas of context to hold in our minds as we think about how we can remobilise the NHS. The first is the important work that members of our NHS do in those local health protection teams, in that public health work, who are directly involved with Test and Protect, trying to manage and control the outbreaks that we've seen. So they were busy in Aberdeen some weeks ago, currently very active in Greater Glasgow and Clyde, in Lanarkshire, in Lothian and elsewhere. Secondly, our health service has to prepare for a system-wide delivery of the largest flu vaccine programme that we have ever undertaken. 2.25 million people to be vaccinated between October and the end of this calendar year. And thirdly, COVID itself, not only in making sure that we have the plans and the preparations in place should we see an increase in the number of cases that require hospital treatment, but in the interim, in any respect, the time it takes to deliver health services in those settings is longer because our staff are wearing more PPE. There has to be much more control on the numbers who are in waiting rooms, cleaning between sessions, including in theatre enhanced cleaning. All of that means that it takes longer to see the same number of patients as we were able to do before the pandemic hit. So all of those are really important areas of context within which we then try and mobilise our health services. So all our boards are planning on that basis. We're planning also to make sure that those who have the most urgent need of care, whether that's in the community or in the hospital setting, are the ones who are seen first. And over the coming weeks, we'll set out more clearly exactly how that clinically determined prioritisation will operate in individual boards. And right now, all the boards are busy working to make sure that they go through everyone that they know is waiting for care and treatment and can identify who they need to deal with quickest and first.
Thanks. Ross Govins from STV.
Afternoon, First Minister. You highlighted there some issues you're concerned about test results. 6 months on, how concerned should the public be that it still appears that the testing regime isn't robust enough? I mean, how worried should they be that these delays are potentially having an effect?
Well, I'm raising it today, to be very frank, with people that I'm concerned about it today. And we've been raising these concerns with the UK government just to remind people the vast bulk of our testing is done through this network of UK-wide regional testing centres, mobile testing units, and then tests are processed at the network of Lighthouse laboratories, and the Glasgow Lighthouse is part of that. And Scottish Government's been fully engaged and involved in the development of that system. But many of the controls over that system lie with the UK Government. So we're seeking to constructively, with us playing our full part, resolve these issues. The system has been working well and it has been working robustly. If you go back through the last few weeks, Scotland has been, not every single day, but in most days, the numbers of tests being done and processed in Scotland is above our population share of the UK. But there have been reports in recent days, and they've been reports in the media of a backlog of tests across the UK as a result of an increase in demand, perhaps, I don't know, in some ways caused by, as happened in Scotland a couple of weeks ago, schools in England going back. And today we have reason to be concerned that the figures that have been reported today are not complete, because some of the turnaround of the tests that have been done in Scotland over yesterday are longer and haven't appeared in today's figures. So we want to effectively get on top of this now. We need to do that in partnership with the UK Government. The Health Secretary has been talking to our counterpart, Matt Hancock, and counterparts in other parts of the UK regularly about these issues. We were concerned over the weekend that one of the ways the UK Government was trying to deal with the backlog was to restrict access to testing, and the Health Secretary managed to avoid that happening in Scotland. But we need to understand exactly what the scale of the issue is so we can play our full part in fixing it. And I'm really keen that we do that urgently. I'll be seeking urgent discussions later today with UK government counterparts just to make sure that we are doing everything possible to get on top of this before it becomes a bigger issue. And it will be certainly a key focus of my day today, as it will be and will continue to be for the Health Secretary. I'm not sure if you want to add anything, Jeane, in terms of some of the discussions over the weekend.
So the discussions over the weekend have involved myself and, as the First Minister said, Matt Hancock, the Secretary of State, but we've also been in contact with Vaughan Gethin, my counterpart in Wales, and in Wales and in Northern Ireland, and here we've been experiencing the same problems. The key for me is that we need to fully understand what are the issues that the UK network of testing, both sampling and processing, is trying to address, so that we can then collectively, with the shared knowledge, work through how that is resolved. We can't do it if we can't contribute if we don't know exactly the scale of the problem and the issues and the options that are available. We're very ready, as the First Minister said, to play our part in helping to resolve this, but we need to have that information, that discussion, and I'll certainly be pursuing that today, as the First Minister has said she undoubtedly will.
Tim Batchel from ITV Border.
Thank you, First Minister. While people understand the reasons for the reduction to only 6 people meeting, there will be those who will lose out financially. We've spoken to a restaurant owner in the Borders who's had a lot of cancellations and is now worried about what this will mean for Christmas bookings, which are normally so important for a business like that. So should there be extra support for businesses like this? And will it be up to restaurants, pubs and so on to police these rules and make sure that the guests who are coming are not from more than 2 households?
We want to make sure that there is continuing support for businesses across the economy, and clearly hospitality faces even greater challenges than many other sectors, although there's not a sector of our economy that's not impacted in some way or other. Our principal priority right now is to work with counterparts across the UK to secure the continuation of the furlough scheme, where businesses are perhaps not able to trade at full capacity. And I hope we will see some positive progress around that. And the Scottish Government will continue to look on an ongoing basis at what we can do within our resources and powers to continue to provide support, as we have been doing through the £2.3 billion package in recent months, which includes rates relief, for example. So this will be an issue of ongoing focus, because we know that for many businesses operating normally is not possible right now. I gave a statistic in Parliament last week that said we reckon about 96% of businesses across the country are trading again, which is good, but many of them will be trading below their full capacity. So that will continue to have an impact on their ability to earn money and pay staff. In terms of obviously the limits that were in place before today of 8 people from 3 households indoors, they already applied within hospitality. So hospitality will already have been used to checking when they're taking bookings that there aren't more households than is required. And what is happening now is that limit is being reduced. I think hospitality have made strenuous and very impressive efforts to make sure they have the right systems in place. And they have my thanks for that. I don't for a second think it's easy for restaurants and pubs to do this. This is not easy for anybody, but I also know that most, if not all, working in the sector know that it is in their interests to make sure these rules are complied with, because this is about trying to make sure that we can retain some normality in life while keeping the virus under control. And if we end up not being able to do that, then unfortunately we would face potentially, and I hope we don't face this prospect of sectors of our economy having to close again, as opposed to operate under the kind of restrictions we're seeing. So, these limits are not easy for anybody right now, but they are an effort for us all, an effort to make sure all of us collectively are trying to keep the virus under control. Household transmission is the biggest risk we face right now of the virus jumping from household to household. That's why limiting household interactions is so important. And my general advice to people, obviously I'm asking people to abide by the limits in place, but generally, and I appreciate how difficult it is for people to hear this, is just generally think about restricting your interaction with other households right now, because if we do that, we are cutting down the opportunities for the virus to spread. And right now, that is probably the single most important thing all of us can do, however difficult I know it is for individuals and indeed for businesses. Lindsay Hannah from Bauer.
Thanks, First Minister. It'll be 2 weeks tomorrow since you announced tighter restrictions for 3 parts of the Greater Glasgow and Clyde Health Board, but the numbers are continuing to rise in these areas. So does this mean that they'll be in place long term? And does it also mean that the restrictions aren't working? Will they need to get tougher before they're lifted?
As I said in my opening remarks, we will have there'll be a discussion later today to review the situation in Greater Glasgow and Clyde, and I think it's better that we communicate the outcome of that meeting after it's happened rather than me speculate before it happens. We've always said right from the outset, and it remains true, the way this virus spreads, the incubation period hasn't changed fundamentally since the start of the pandemic. So it does take a period of time to understand whether restrictions are having an impact, and that can be a 3 or 4 week period. So we'll look at this later on and make judgments. I don't want to raise anybody's hopes right now, though, that these tighter restrictions are about to be lifted in the parts of Greater Glasgow and Clyde that they apply to, because, as you rightly say, the case numbers that we've seen in recent days have still been significant. It may be that these restrictions need a bit longer to have the desired effect, but we'll obviously give more detail of that after the discussions later today have taken place. And in terms of your terminology, long term, I appreciate you probably didn't mean it in the sort of long term. You know, the pandemic will not last forever. And hopefully science will come in and help us get out of the situation we're in right now. And you know, hopefully this time next year things look a lot better and we're looking back on this as opposed to being still in it. But right now we have to focus on the here and now. I know I kind of was talking about this on Friday, that we're getting to that stage of the year when people normally start to turn their attention, whether they want to or not, to the Christmas period. I know that is the case, but we're in a pandemic right now, and I think we've got to, as far as we can, focus on the things we need to do now in order to stop this situation getting worse than it has to be, which is why I would ask everybody to focus on the things we're asking you to do now, because the more we do them, the more chance we have of stemming an increase and not having tougher restrictions down the line, and perhaps having a shorter period when even these restrictions have to be in place. Do you want to say any more, Gregor, about the Glasgow situation and what will be considered later?
So the National IMTs continue to meet on a regular basis over the last 2 weeks, and there was a meeting just this morning to discuss the data from over the weekend and how we plan to take forward the further analysis of locations where some of those index cases have been identified. What's coming through from the data we've been charting, particularly over the last week, is that there may begin to be a slowing down in the rise of cases over that point in time, but it's still too early to tell whether these measures are having a full effect yet. We've got to remember that the incubation cycle for this virus is up to 14 days, and therefore it can be quite a significant length of time before you actually see the effects of any intervention actually starting to play through. At the moment, we still see the strongest signal coming through from household and social settings, but we're charting very closely the volume of contacts that people have within these settings just now. There are some other kind of very weaker signals which are coming through from other sectors, but at this moment in time, not sufficient in that they're giving us any kind of great cause for concern.
Jack Foster from Global.
Good afternoon, First Minister. Just having done some quick figures, so forgive my hurried maths, it looks as though under 3,000 tests took place in the past 24 hours and under 7,000 in the 24 hours prior to that, which obviously seems quite far below the capacity of the target anyway of 15,000. Given that we have heard numerous stories of people waiting sometimes up to a week for results, obviously there's no shortage of demand here. Are you flexing, for want of a better word, the number of booking slots that are available as a result of this backlog that you were talking about at the start of the briefing?
let me try and sort of unpack this as much as possible. Remember, the percentage positive figure I give is a percentage positive of people newly tested. The overall number of tests will usually be higher than that because some people are tested more than once for often good clinical reasons. So what we think may be the case today is that we don't yet have full figures for the actual number of tests that were done yesterday. That's what we are still seeking to resolve, so I don't want to speculate too much more on that. In terms of the capacity, and remember the testing system, the main testing system that members of the public will access is in Scotland is part of a UK-wide network. So the allocation of slots is done on a UK-wide basis. That's what we were referring to earlier on. There was a proposal over the weekend that the available slots at mobile testing units and regional testing centres in Scotland would be reduced, and the Health Secretary managed to avoid that happening so that we retained full capacity for Scotland there. And we have no indication at the moment that there is any significant issue in Scotland with people accessing testing slots. Now, that's not to say nobody has, but we are not seeing at the moment the issues that we were seeing in the few days when the schools went back of people being referred quite far away. The issue that we do appear to be suffering some impact from, and again it's a UK-wide issue, is a backlog in tests being processed that is then leading to a longer turnaround time. And this issue that we've got a concern about today, that we don't yet have a complete data set to report today. Now, I can't say any more about this right now because we haven't yet managed to get completely to the bottom of that. But I didn't want to stand up here today and say 70 positive cases today and people think, oh, that's a massive reduction from yesterday, because we don't necessarily think that will be the case, that we don't yet have complete data, or that all of the tests done yesterday will not necessarily all have been processed. So we do have a concern about this, which is why we are escalating the discussions we're having with the UK government today to try to get a better understanding of what the scale of the UK-wide issue is. But also, because I equally don't want this to sound as if I'm saying it's for the UK government to fix, we want to play our full part in fixing this and finding the solutions, but we need to have a better understanding of exactly what the scale of the challenge has been faced UK-wide. So we will continue to provide updates on that as these discussions carry on. The advice to people, though, is unchanged. If you have symptoms, you go on, book a test and get tested and self-isolate in the way that you are normally advised. Tom Eden from PA.
Thank you, First Minister. Good afternoon. Firstly, just to you, last week, towards the end of the week, you were asked about sort of gatherings of large groups of children, and you said you were going to seek sort of more expert advice about whether they could be exempt for things like birthday parties. I was just wondering whether you'd managed to get that advice and if there was any new guidance. And to the Health Secretary, it sounds quite alarming to hear that the Health Secretary in the UK is sort of talking about restricting the number of tests in Scotland. Can I ask what he said to you? What was his evidence and argument for doing that, and how you managed to persuade him not to?
There is a demand issue across the UK, which is what the reason was, but we want to make sure that we are protecting Scotland's capacity. I think the Health Secretary can add more, but we are seeking to resolve these issues constructively. Tom, I think you maybe didn't catch my remarks earlier on. I said that I referred back in my opening remarks to what I said on Friday. I don't yet have that advice, and as soon as it is available, I will obviously give the outcome of that in terms of whether there's any more flexibility we can give around children and how they are treated in these limits, but I don't yet have that. Jeane, do you want to add anything?
The only thing I'd add is, as the First Minister said, there is a UK demand issue, and there is an issue with the speed and the capacity of processing the tests, and a backlog. We need much more information and detail in order to play the constructive part in resolving this that we want to. I'm not going to go into the details of the conversations that I had with Matt Hancock or indeed with Von Gethin. Suffice to say that they were constructive conversations, and I was pleased that we managed not to have the restrictions on access to testing slots that were originally being proposed, But this is work that we need to continue because we need to try as best we can to work cooperatively and to resolve this situation.
Derek Keeley from the Courier.
Thank you, First Minister. I wanted to ask you about the R number, please. Scotland has seen a slower exit from many lockdown restrictions, and there's been kind of no big push to return to offices. But the R number is higher here than other parts of the UK. Can you offer any insight into why that is the case? And do you think there's any link to schools going back earlier in Scotland?
I'll hand over to Gregor as well, but if you, which I'm sure you have, Derek, been listening over recent weeks and months, part of the answer is maybe in what we've been saying. We know the R number, when prevalence is lower, becomes less reliable an indicator. Not a completely unimportant indicator, but in a sense, the lower your prevalence, and notwithstanding the rise we are now seeing in cases, prevalence is still relatively low, and we think probably significantly lower than it was in the early part of the year. So actually, a bit counterintuitively, that means very small changes or a particular outbreak somewhere can have a disproportionate impact on the R number. So hopefully we won't see further spread to greater levels, but as we see an increase, that's where the R number, we start obviously paying even more attention to that. But partly this is about big or seemingly big changes in the R number being occasioned by actually relatively small changes in how the virus is operating. But Gregor can probably explain all that a lot more expertly than I've just managed.
So the R number just now, although it's estimated to have risen a little bit, it's still an unreliable source to use by itself to tell us where we are in terms of that epidemic curve just now. The reasons for that, as the First Minister has already outlined, is the overall prevalence of the disease that we're seeing in Scotland just now. And what we can say is that when we look at the case numbers and the way that they are rising, we can see that we're still in a linear period of growth. So we haven't reached anything like the exponential type of growth that we were experiencing earlier on in this year, in March or April, that linear growth is still controlled, although rising. And that's why just now, I think both myself last week and I heard again today, the First Minister today, say that we're in a precarious position. Because if we don't take notice of that, if we don't respond to that collectively together as a population, the risk is that we will move into that exponential phase of growth. So we've got an opportunity just now that we really need to take to make sure that we're doing all we can individually and collectively to make sure that we're limiting the ability for this virus to really kind of take a hold and pose a resurgence just now. It's the simple things that are going to make the biggest difference just now, really questioning whether that travel that you've undertaken is really essential, whether the trips that you're making were as safe as they could be, just making sure that constantly we're checking back in with ourselves to make sure that we're doing all that we can to limit the spread of this virus, to prevent those case numbers rising any further and to prevent us slipping into that exponential period of growth again.
And sorry, Derek, you mentioned schools. Of course, our schools have been back for a bit longer than schools in the rest of the UK, although some pupils went back in Wales before the summer. But I think we've been back with full-time education for longer than other parts of the UK. And while it is likely that, or possible, that will have had an impact at some extent, if you look, and again, I don't want to put too much store in these figures because we're in a sort of fluid and changing situation right now, but over the past couple of weeks, even though we've every part of the UK has been seeing a rise in cases, Scotland's rise day on day looks as if it has been somewhat lower than in other parts of the UK. So even with schools back, that would suggest that the hard work we've done over the summer to drive to as low a base as possible has actually stood us in good stead. It gives us no room at all for complacency, but it does mean that we are facing this winter period and this potential surge in cases again that's been experienced across Europe from a lower base. And that gives me some degree of hope that if we all do the right things now and stick to these new limits and new rules, then we're not going to have an easy winter. I don't think anybody was ever expecting we'd have an easy winter, but we have a better chance of keeping the whole situation under a degree of control. Simon Johnson from The Telegraph.
Good afternoon, everyone. I appreciate this is anecdotal, but I was out this morning and I could see large groups of secondary children walking with their friends to school, not really seeming to adhere to this 2-household rule. Is it realistic to expect children of that age to basically stay apart when walking to and from school, and then say to them, okay, but as soon as you pass that school gate, you're perfectly fine to mix? And is there a danger that if a rule like that is seen as being illogical, that compliance may be suboptimal?
Look, these are all difficult issues that we're grappling with, which, you know, is important to try to communicate this as clearly and as accessibly as possible. I can't remember, Simon, if you were on the call on Friday, but I tried to sort of address then the apparent inconsistencies, and I referred, I was getting these questions on Friday morning from a very early hour from my niece, who was saying to me, you know, how come I can sit with my pals all day at school, but as soon as we leave the playground, we've got to be apart again. And what I was trying to explain to her, and explain by extension to the country, is that these apparent inconsistencies are actually the essential trade-offs we need to make. It is by restricting our household interactions in other ways and in other settings that we try to protect the ability of our young people to be at school and interacting a bit more normally in school, because we've deliberately decided as a country to prioritise having young people back at school full time. So the more, you know, outside the school settings, all of us are limiting interactions, the more chance we've got of being able to keep schools open. So that appears to be inconsistent. It's just a trade-off. We can't do everything right now. So we've chosen to prioritise the school half of what young people do, but the cost of that is restricting what they and the rest of us can do out of school, because we cannot do everything. If we try to do everything, it will run away with us and we'll end up with schools closed again. So these are just trade-offs that we have to make. And they're not easy for people to understand, which is why I think it is so important that we stand here day in and day out and try to explain these things so that there is a deeper understanding. And of course, it is always going to be more difficult to not just persuade and by young people here, I'm talking about school-age young people. Of course, it is much more difficult for kids to do that. Now, that doesn't mean we don't try to persuade them and encourage them to stick to the rules when they're not in school and stick to the rules that they're meant to stick to in school. But of course, as adults, the more rigorously we all stick to the rules, then the more we perhaps protect the overall situation if kids are slipping up a bit more often for understandable reasons. So let's, us as adults, shoulder as much of that burden as possible while supporting young people to abide by the rules as much as they possibly can. Alistair Grant from the Herald.
Hi there, thanks very much. Figures show there are now 78 care homes with current or suspected COVID cases. This seems to have been creeping up in recent weeks, and I think it's now the highest it's been since July 22nd. Is this a cause for concern? And if we see a second wave of coronavirus, will you prohibit the substantial movement of patients from hospitals into care homes that we saw during the first wave? Will you do things differently? And if I can just ask, just really quickly as well, I think the Welsh Government has set a long-term ambition to see about 30% of the workforce in Wales working at or near home. It says this could reduce congestion and pollution, improve work-life balance, boost economic activity in local communities. Obviously, the message from the UK government to workers in England has been very much about getting people back into the office. Does the Scottish Government share the Welsh Government's ambition on this?
Okay, I'll hand over to the Health Secretary in a moment who want to say more about care homes. The situation generally is a concern, and obviously within that, the situation or a potential transmission of the virus within care homes, of course, is a concern, and one we are very, very vigilant about. We are already doing things differently, so we've got a number of different procedures in place to try to protect care homes compared to the situation at the outset of the pandemic, and the Health Secretary will be able to say a bit more about that, but that of course includes the situation for testing before admission to care home, testing of care home staff on a regular basis, and the guidance that is in place overall for care homes. And you're right to point to an increase in the number of care homes with a case. Of course, that number of 78, I think it is in the most recent statistic, is significantly below the number of care homes with an infection, at least one case of the virus much earlier in the year. That does not, of course, mean that we should be at all complacent about that. Before I hand over to the Health Secretary to say a bit more about care homes, on working from home, We've not set a particular target like the Welsh Government, but our position is far closer to the Welsh Government's than the UK Government's right now. And, you know, I would sort of point to two aspects of that. Firstly, right now, our advice remains to be work from home if you can. There are some offices where you know, they have been at work throughout because the work that they do requires that. But if you don't need to be in an office, if you can work from home, our advice is to continue to do that. And that's part of the trade-offs that I talked about. To keep schools open, we have to limit our interactions in other settings. And right now, to have everybody back in offices would put lots of more people onto our public transport network and have significantly more people interacting indoors. And that's why we don't think it is the right thing to advise at the moment. That said, we are acutely aware of the impact of having large numbers of people working from home on other parts of the economy, and we continue to work with, for example, the Scottish Chambers of Commerce about how in due course we support safe return. But the second aspect, which I guess is what the Welsh Government has put a target on, which we haven't put a target on yet, is I think we should, in a whole range of ways, be using the pandemic experience to think about, do we want to go back to exactly how life was before? Is there an argument to say we should support people in some circumstances to work from home, or to have, you know, community hubs that allow people to work more locally, cutting down the commute? Is that better for the environment, for health and well-being, for quality of people's lives? And I think these are very legitimate debates and considerations that we should be having, which is why our position, notwithstanding absence of targets here at this stage, is not hugely dissimilar to the one that the Welsh Government has been articulating. Jeane.
So of course we monitor and look very, very carefully, I do constantly, at the number of positive cases in care homes, and try to understand where we may see a slight increase, what is behind that. In some of those numbers, that is care home worker who has tested positive as part of our weekly care home worker testing programme. But that then can trigger making sure that the residents in that care home are COVID-free. So that's the first thing to say. The second thing is all the steps that we have put in place, including, as the First Minister said, testing, the requirement for negative tests before we have any admissions, whether from the community or from hospital, into care homes, the risk assessment that has always been there, the clinical and other risk assessment, the use, proper use and supply and distribution of PPE, and the very important involvement of local directors of public health and local NHS nurse directors in making sure that there is the right staffing rota and the right infection prevention and control measures and support given to care homes to make sure that happens. All of those remain in place and will remain in place. The care home sector and the care at home sector is part of the winter planning that I touched on earlier. So that isn't just about our hospitals and our primary and community care. It's also about those sectors. Scottish Care and others are involved in working that through with us to see what more we might need to do and should do to ensure that we are planning well to meet the challenges of winter in our care home sector. And of course, part of that is the decision to extend the flu vaccine programme to all social care workers and to encourage all of them to take up that opportunity and be vaccinated against the flu virus.
Thank you. Christine Lavelle from The Sun.
Thank you, First Minister. It was just a couple of points of clarity just on the new rules that have been published today. As they currently stand, the regulations seem to mean that children would be breaking the law if they're in a playground and play with children from more than one household. Is that correct? And also, will people be allowed to play five-a-side football against groups of friends at commercial centres if they're not playing in an organised league, for example?
On these points of detail, I'll have a go at answering that just now, but we'll also come back to you with proper... Sorry, Christine, your sound has disappeared. Did we?
Oh, I don't think I said anything else. Can you
hear me? Sorry, you were still talking on the screen. It must just be a...
Right, okay.
My apologies. It was this. You were still talking. It must just be a technical glitch this side. So sorry for that. So I've lost my train of thought now. I'm going to come back to you with a proper detailed answer to these questions so that we're getting it right in terms of how these things are reported. In the school environment, of course, it's the school guidance that would apply. Obviously, outside of schools, it's the general guidance. And we did say that there is an exemption for organised sport where there are other pieces of guidance in place regulating activity. That guidance applies. And of course, guidance has been put in place for organised sport. But we will put very detailed answers to you, and I'll make sure these go on the Scottish Government website as well. There is guidance already on the Scottish Government website trying to answer as many of these questions as possible, but where we get other ones that perhaps people just need a bit more clarification around, we will add to that so that people have as much certainty and clarity as possible. Conor Matchett from the Scotsman.
Thank you, First Minister. Apologies in advance if you covered this on Friday. I was on a rare day off, but just in case, I'm wondering whether or not you could update us on university testing, if possible. Obviously, Edinburgh and many other cities are seeing students arrive for Freshers' Week this week. Are any of the walk-in centres that you've spoken about previously opening this week or in maybe next week? And are you confident that universities have enough restrictions and measures in place to restrict the possibility of viruses spreading among households of up to 12, for example, in Edinburgh?
I'll hand over to the Health Secretary who can give a bit of an update on the walk-in centres. The general approach to university college testing, of course, was set out in the updated guidance that was published, I think now 2 weeks ago for the sector, which, as well as testing, included the arrangements that should be in place for blended learning and the arrangements that should be in place around student accommodation. We obviously, with the sector, will be monitoring this carefully. You know, a bit like schools, we know it's really important to have young people back in education for their education, but also for their well-being. But things can't be exactly as normal right now. So I know the university sector is taking this very seriously and will continue to have a very close dialogue with them. One of my nephews started university this weekend, moved into halls of residence, so vicariously through him had some insight into the arrangements, the reception arrangements that were being made, which seemed good, but obviously we need to watch this on an ongoing basis, and there's very good dialogue between the government and universities and colleges as part of that. Jeane, on walk-in centres.
In terms of the walk-in centres, of course, there's one already open in St Andrews. Another one will open, 1 out of 2 will open in Glasgow this week. By the end of September, we will have a total of 6 walk-in centres, initially located around those large university towns and cities, if you like, and then we will move to bring in more walk-in centres through the month of October. But at the moment, the next one to open will be one in Glasgow this week.
Rachel Watson from the Daily Mail.
Thanks, First Minister. People living south of the border have been encouraged to report their neighbours or family or friends if they think they are breaching the new rule of 6. Would you encourage people in Scotland to do that as well? And would you encourage them to challenge neighbours or friends or family if they do know that they are breaching this new rule?
Let me try and answer this kind of pretty directly, but also I hope with a degree of sensitivity, because and anybody who's listened to me throughout this will have formed, I hope, a very firm impression that I think we are better served by a sense of collective solidarity in this pandemic, where we're doing things for ourselves, our families, but for each other, because we can't get through this as 5 million or just above 5 million individuals. We can only get through this as a society pulling together. So I don't want us to see it, if we can at all avoid it, as, sort of spying on your neighbours or reporting your neighbours to the police. I want all of us to come at this from, why are we doing this? It's to protect each other. And I think that's served us well so far, and I think it will continue to serve as well. That said, and the Chief Constable has said this, if you are worried that your somebody close to you, or physically in close proximity to you, or somebody you're aware of is flagrantly breaching the rules and having a house party or something, then the police are there to deal with that. It shouldn't be for you to have to go and deal with that. It should be for the police to come, and they will deal with it in their proportionate and sensitive way, and where necessary they will take enforcement action. And that's the police's part of this overall collective endeavour. But I come back to this. This is different to the kind of normal situation individuals face. Right now, if you're somebody who takes part in extreme sports, if something happens to you, well, okay, the emergency services are engaged, but that doesn't do damage to other people. Right now, if you take a risk, if you breach the rules here, potentially you are harming not just yourself, but lots of people around you. So we must think about other people right now, not just ourselves. And that's the spirit I think we will get through this much better and much more strongly. So of course the police are there to do a job. People should have recourse to that when they feel it is necessary. But if we all act in that spirit of collective solidarity, then the occasions in which people will need to do that will be fewer than they will be otherwise. Richard Percival from the Daily Express.
Thank you, First Minister. As Rule 6 comes into force across the UK today, several academics are warning that the UK is diverting from four nations' approach to tackling COVID-19. They also warn people becoming increasingly concerned, confused by the differing laws and regulations between four nations. What is your view on having a united UK-wide approach to tackling the pandemic? And if I may, are there any decisions taken by the Westminster government, you can point to and say we wouldn't have done that?
My apologies, Richard, you were kind of breaking up a little bit there. I think I got the gist of your question, but if I appear at any stage to be answering something you didn't ask me, it's because I didn't fully get the question. But I think what you were asking me was, would it be better to have the same rules for the rule of 6 across the UK? I've covered this so many times in the past. As First Minister, with the Health Secretary and the government here, we've got to take decisions that, in our best judgment, are right for Scotland. And that's what we've tried to do all along. Sometimes that has led us to an aligned position with the UK government. Sometimes it's led us into a slightly different position. And, that's been true of Wales and Northern Ireland. I think we can overstate the degree or the potential for confusion. People tend to know which part of the UK they live in, so they know which government to look to for the rules. And while with the so-called rule of 6, there are differences in the detail, I think actually all four administrations are saying no more than 6 people. So in terms of a kind of UK-wide message, that is probably not an unhelpful position to be in. But people, for the detail of that, know which government in the UK to look to get their information. So I think we just have to continue, all of us, to take the decisions we think are best. And remember, there have been differences all along. So the rule of 6 is replacing a rule in Scotland that said 8 from 3 households. In England, it's replacing a limit of 30 people that were allowed to gather together. So the rules previously were different, and perhaps they are, as I say, with differences in detail, perhaps they are more aligned at the moment than they have been over the past little while. But if you're in any doubt in Scotland, you go to the Scottish Government website to find the detail of what you should and shouldn't be doing. Mark McLaughlin from The Times is the last question today.
Hello there. First Minister, can I ask about students going back? There are students complaining that they've gone back and they've spent a fortune on accommodation only to be told that all of their courses are still going to be online. Is there going to be any support for them? And a question for the Chief Medical Officer about the ratio of tests. Now, if you look at the number of positive tests, it looks like we're back to the bad old days of early April. But the ratio is actually quite flat. Would you describe what we're in as a second wave or a second bump?
In practical terms, I'm not sure that makes that much difference, but I'll pass that to the Chief Medical Officer. The one point before I do, and then I'll quickly take the point on universities, is we do have to, and I covered this in one of the briefings last week, we have to have a degree of caution in comparing case numbers today to case numbers back in March or April, because we are testing more people. So, 200 cases in March and April doesn't mean exactly the same as 200 cases today, because that will be a lower percentage of the overall tests that are being done. But I'll let the Chief Medical Officer maybe talk about the terminology. On universities, the government has put in place guidance for universities which deals with recommended approaches to blended learning, for example. But in terms of individual student arrangements, they are better to address them with their individual institution, because different universities with different courses will have come to slightly different arrangements. What we've sought to do to help universities is to put in place overarching guidance. Gregor.
I think the situations are completely different from what we see ourselves in just now to what we saw in April. As I've already said earlier on in the briefing today, at this point in time, although we have a rise in cases, it's a very linear rise, and it's not that exponential growth that we saw earlier on in the year. And it's a different testing regime that we have as well. Not only are we doing symptomatic testing in a different way than we were doing in April, but we're also doing asymptomatic testing in amongst that as well. So the proportion of cases that we are seeing who are returning positive just now certainly seem to be of a much lower level of cases than we saw in that period in time. It's also a very different demographic that we're seeing turning positive as well, and that's got all sorts of implications for both how we try to control that spread and the transmission of the virus, but also the impacts that it has on our National Health Service as well. At this point in time, it's tending to be a younger age group that, by and large, that is being affected and is turning positive. So we're not seeing at this stage that being shown in a commensurate rise in people being admitted to hospital or being admitted to ICU, although there has been a very slight uptick in that over the last week or so as well. So these are things that we need to continue to monitor. But essentially, I don't believe that we're in a second wave just now at all. We're seeing a resurgence of the virus. The virus has never gone away to indicate that we're in a second wave at all. The terminology is really important in that respect. But what we are seeing is a rise in the number of cases from what was our low baseline that we experienced over the summer months.
Thanks, Gregor. The other just point in terms of, I suppose, difference in our testing approach now to previously is we're testing more people now, but also back in the early stages when we were testing a lower number of people, most people who were being tested were people who had been admitted to hospital. So clearly that would have had an impact on the positivity, and many people with milder symptoms, including perhaps younger people, weren't being tested back then. So these are just differences that it's important to bear in mind when making simplistic comparisons between now and earlier on. That said, and I'll round off my remarks now with thanks to the journalists, to Gregor and Jeane and Yvonne for our BSL interpretation today, is that we are seeing a rising number of cases right now, and there is no getting away from that. So that makes it really important that all of us abide by all of the advice, all of the rules, and do all of the not easy but basic things that give us the best possible chance of keeping this under control. So I want to end just by appealing to everybody across the country, again to those watching, and to ask you to spread the word as far and as wide as you possibly can. Firstly, to remember, if you live right now in Glasgow City, in East or West Dunbartonshire, in Renfrewshire or East Renfrewshire, and in North or South Lanarkshire, you should not be visiting any other households at all right now. That's really important to try to stem the rise in cases in these local authority areas. And if we do that, that should have a positive effect on our overall national picture as well, given that these are very populous parts of the country. If you live outside these areas, the new rules that are in place from today, please abide by those. That means you should not be meeting more than 6 people from a maximum of 2 households at any one time. And that applies indoors, in your house, a pub, restaurant, cafe, as well as outdoors. And again, that is to try to limit our interactions with other households, to stop the virus jumping from one household to another and then on from there. So as far as possible, even beyond these limits, if you can, just reduce and restrict your interactions with other households right now. My third plea to you is, if you haven't already done so, to download protect.scot, the contact tracing app. That is an enhancement to test and protect, and it means that if you have COVID and you're in contact with somebody randomly on public transport, you don't know their name or their details, they will still, if they are a close contact, they will still get a notification if you test positive for COVID. So that really helps us to encourage isolation when necessary, and again break those chains of transmission. And lastly, my usual plea is just remember the facts, rules in everything you're doing, wherever you are. Remember to wear your face coverings when you're in enclosed spaces. Remember to avoid crowded places. If you turn up somewhere and it's crowded, go away and go somewhere else. Remember to clean your hands regularly, clean hard surfaces. That's, the way to avoid picking up the virus that somebody else may have left down. Remember to keep a 2 metre distance from people in other households whenever you can. And if you have symptoms of COVID, self-isolate and book a test immediately. I've talked today about some issues we're having with the testing system, which we hope will be resolved, but don't allow that to put you off booking a test if you have any of these symptoms. My thanks to all of you for complying with all of this. I absolutely understand that it doesn't get any easier, but if we keep doing all of these things, then we will get through this better than will otherwise be the case, and hopefully hasten the day when we look back on this as something that has happened in the past, not something that we're still dealing with in the here and now. And don't forget, ultimately, it is about saving lives and making sure we don't go back to a situation of having large numbers of people dying. So all of these things help us protect ourselves, they help us protect people we love, they help us protect the NHS, and they do help us save lives. So thank you very much, and I will see you tomorrow at the usual time of 12:15. As you know, the BBC will decide themselves whether or not they air this on BBC every day, but if any day that is not the case, you can still watch this briefing on Scottish Government channels if you wish to do so. So my thanks just now, and I'll see you tomorrow.